The information in this podcast is for entertainment purposes only. Consult your healthcare provider for proper care regarding your specific situation.
Hello. Welcome back
Yay!
to Rattled Nurses.
I don't even know what episode we're on. 29? Is that
Yeah.
what that says? Maybe that.
I have
Anyway.
no idea, honestly.
Happy
Yet here we
Wednesday.
are again.
Here we are again.
Oh, yeah. This does say 29.
Well, I didn't know, like, when I make these, I don't know exactly what number. Or if, anyway, regardless. We have another product review.
Fun. Okay.
Delana found another cool thing, guys.
So I found this at Walmart. It's a simple little thing. So cheap. It's only like $3.50, I think, ish. But I like it. It's by the brand Joey, Joie, Little Accessories. It's a dishwasher bag, and it's made of silicone. And so for, your passies, your nipples, anything like that you want to run through the dishwasher.
Dishwasher safe.
Actually, can put all those little items in here. And then it just folds over and snaps down, kind of like a little Ziploc bag.
Yeah, the picture is like
together.
Got some passies,
Oh.
the rattle, a little like the steamable nipples. These items in the silicone mesh, BPA free, dishwasher safe. Manufactured in the UK.
So
You
can
know
run
it's
it through
good.
there. So it's just a little pocket
This is not
to
a toy.
keep them from slipping around.
Keep it away from pets
But
and children. So this was at Walmart. It's also food grade silicone, obviously. And then you can.
Oh, look, it'll go that way too.
I was gonna say.
I didn't look at it going that way.
There's a different size, or
Yeah.
Oh, look at that, genius!
Now that's cool. Okay.
Yeah.
So your long items the other way. Ooh,
And
look,
then-
you could put even not for, baby stuff. You could even put your lids for your tumblers in there
You could.
and
You
run it
very
through the
much
washer. That's kind of cool. And then I guess you could use it in your sink as a
Strainer, and then you can just wash it
so
by
many
itself.
uses.
Okay, can I play with it now?
Yeah.
I want to play with the thing.
But of course, it's marketed as a dishwasher bag, and it's in the baby aisle at Walmart. So, kind of cool.
Joey? Joie. Joey. Yeah, I would be getting one of these to put my straws in here.
Yeah, exactly. I like that one.
Fun. It just sort of snaps together.
I'll
like
give that
y'all.
one an enthusiastic 5 rattles because it's just so simple. Why didn't we think of this before? Handy dandy.
It is handy dandy. I'm going to give it 4.
Even like little measuring spoons and things like that can go in there.
This is true.
So,
I'm going to give it 4. I feel like they need to market other things from this, which is not the product's fault, but it's a cool little item.
right.
It really is.
It could be found in other areas
Yeah.
in the grocery store
Yep.
for sure. So,
How fun.
yeah,
Good find.
I like that one.
Cute. Now you can go wash your tumblers and your straws.
That's right.
Perfect. Dishwasher bag. Little accessories. Now there's a Joey. It says there's a Joey shop on here too. So now I got to see what little accessories they have on here. JoeyShop.com.
Yep.
Okay.
Yep. I'll have to look that one up.
Fun stuff.
All righty. So there you have it. Now, on to the meat.
Us rattling. Rattling and rambling.
The meat. So we're going to talk about, a couple of weeks ago we did an episode, the top 10 reasons that we feel like moms call the nurses station. in relation to their baby with questions they have. So on the flip side, we're going to cover the top 10. Actually, we have 11.
I added one. I'm messing up the numbers.
11. We have 11 reasons that mamas call for questions about themselves.
Common call outs. Mom edition. But okay. So this is again, well, I do want to reinforce. These aren't to deter anybody from calling us. We're not saying, oh my gosh.
Oh, absolutely not.
Oh my gosh, these patients call for these common reasons. No. This is so you know, again,
Please
call us. If you have a concern, this is not to deter you from that. It's usually, these are things that we experience. Like, so if you watch this, you're about to have a baby, then you're armed with the knowledge like, okay, that's normal. I'm not going to stress about that.
Yeah.
You know, okay. That's the purpose.
Maybe I shouldn't be really scared, but I still need to talk to the nurse.
Yes, and that's fine. Please call us. If you forget or you're not sure or you want assurance, please call us. We'll give you that. And some of these are usually we respond more urgently than others, but that's with anything. We have that for babies too.
Yes.
So, number 1 is I felt a gush. Please call us for this.
Yes.
Please do.
Because sometimes it's
nothing, and
very
sometimes
urgent.
it is urgent. Sometimes it's nothing, and sometimes it's everything. So please call us for this. Because sometimes, especially after you've had a C-section or epidural, you don't always feel everything. So if you're feeling a gush, it may be nothing. It may be clots. It may be just like, our grape and cherry size clots. That's a normal part of recovery. But at the same token, we've gone in and a mom has been like, oh, I think I felt something come out. And we'll go in, check the uterus. And I've massaged a cantaloupe out of there one time. So,
or they might be sitting in a little puddle of blood. And that's very important for us to take action.
We need to take action on that. That is an urgent call. So and usually it's nothing, which is great most of the time. Usually it happens if you're changing positions, if you laugh, cough, or while you're breastfeeding. Like when you breastfeed, your uterus contracts, and sometimes it pushes a little bit of extra out. But yes, that is one of the common ones. I felt a gush. So
just call us. Don't panic. We got it. We've done this before many times.
So we always want to check that and make sure it's not too much. Okay. Next one.
No milk. No milk.
I don't have any milk.
My baby's so hungry. No leche.
I was going to say, we also live in Texas, so it's also no leche.
No leche.
So,
that's true. No milk, but you have colostrum.
Yep. You do have that.
We have colostrum. And the majority of the time, we can hand express some colostrum to show you that you do have colostrum. Babies don't need much. And typically, most of the time, your colostrum is going to be all that baby needs. But we do have resources. We have donor milk and we have formula if that makes you feel better and that's something you want to do. But
it usually takes a good 3 to 5 days, depending on the mother, her hormones, whatever. It usually takes a good 3 to 5 days. And when we get this call, it's usually when baby's doing their cluster feeding phase. So again,
that's what they're supposed to do. That's their job, remember?
They have one job.
One job.
And so, yes, and they go through that little phase. And I always try to give my moms a heads up and be like, okay, we spend the first day trying to wake them up. And we spend the second day trying to get them to go back to sleep. Because they marathon feed, and then moms will say, I'm not giving them anything. You are. But baby's purpose at this moment in time is crucial because it is telling your body, make me that milk, honey. This is how much I'm going to need. This is what I'm going to need.
Supply and demand.
Supply and demand. So, yes, just like she said, if you're absolutely not, you're like, okay, I need a break. We have donor milk for that. And if you, just depending on your entity, I think a lot of postpartum entities are trying to offer that now. But we've got donor milk and formula supplementation. We even have moms that express their own colostrum within appropriate weeks in advance. And bring that in, and we can supplement with that too. We can warm up your colostrum if you'd like. So store it and warm it. Yeah. But that is a normal thing. Just keep latching. Just keep latching.
Yes, Nemo.
Yes. Latching. Exactly what I was thinking.
Okay. Number 3. With C-sections, we get lots of calls that there's a burning sensation at the incision site. Moms get really worried that there's something wrong. There's not. It's really very normal, especially to feel it on one side of the incision and not the other is pretty common.
Usually that's when is for the incision wise, it's when they're sewing everything in between and then they're pulling. So one side does get more tender, but what's happening in that burning situation, and sometimes even when you take pain medicine, it oftentimes doesn't help. And the reason being is because it's a nerve pain. You know, we slice those little nerves in half and they're trying to reroute, being like, where did my other half go? And so it's your nerves waking up. Your nerves are like, what happened? Who cut me in half? And a lot of pain medicines don't really act on those nerve receptors. So with that being said, sometimes a little ice pack intermittently will help that. Don't leave it on the whole time, but sometimes an ice pack will help calm those nerves.
I feel like that helps a lot usually.
Yeah.
With the moms.
Again, that's a normal thing. And again, we're happy to come in and explain that to you, just to ease your mind. But let's see.
And then there's a few things with the incision. We get some phone calls, or not phone calls,
But
call lights. Moms will call me in there and say, I think something just happened to my incision. I coughed really hard and I swear I felt something pop. Can you look and see if everything looks okay? And to this day, everything's always been fine. I've never seen anything happen to the incision from a cough.
I don't
Not to say that it can't.
Yes. I don't, coughing or sneezing or laughing sometimes it'll disrupt. So that one I'm not sure about the mechanisms of why they feel the pop necessarily.
Right.
But I will tell you that usually it's not just one little layer of stitches that's holding you all in. So a lot of times people think like, okay, if something happens, all my guts are going to fall out. Not the case. Like each layer gets their own TLC, like little special care. And usually what it is I think that kind of like the skin stretches a little bit and it does like a little snap or something. Or
Maybe.
I don't know what that is. But usually it's nothing. Usually it's nothing, but we can always double check.
Usually there's no even like drops of blood or drainage or anything from the incision that we can see.
I will say one of our previous doctors who used the removable, like the metal, the old school staples, a lot of the times those would be coming out. Which is fine because,
And those do tend to.
They do. And they're so small that sometimes they'll be like, that's another one. My staple is coming out. Well, I'm not going to put it back in. So
right.
let it do its thing. I'm not going to pull it out either. Just kind of let it fall off on its own.
Yeah.
But
we can put the steri strip if we need to.
That's what we used to do. I mean, but I mean, usually that's not a big deal either because they suture up the inside as well. So
right.
But again, if you feel an incision pop or you feel like something's bursting open, please let us know. We will check. Another one is urinary incontinence. Your bladder, whether you have a vaginal delivery or a cesarean delivery, your poor bladder has been going through the ringer for the past 5 months at least. Like while your uterus is shoving it out of the way, being like, this is my space now. Get out of my way. Your bladder has just going left to right. Like it doesn't really know what to do at this point. So when your uterus is kind of going back down to the pelvic cavity, your bladder has this room. Sometimes it spasms a little bit. And sometimes even if you feel like you have to pee and then you get up to go pee, sometimes you don't make it. And that's okay.
Right.
That's okay. A lot is happening. Sometimes your bladder just really needs to rest a day before it will go back to functioning normally. And that's fine. If something happens, we'll help you get cleaned up. Don't be embarrassed.
Yeah.
Don't be upset. It's
It does happen.
It does.
It's no big deal to us,
Not a big deal.
honestly. I mean, I'm sure as a patient,
It's embarrassing. Yeah.
yeah, but don't be embarrassed with us.
Honestly, sis, I'm glad you're peeing, because if you weren't peeing,
Yeah.
there'd be a problem. But yeah, sometimes, and if this is something that's persistent, the doctors can prescribe some medications short term. These would be short term medications that help, because a lot of times what it is too is that little muscle that's inside your urethra soft tissue is kind of doing a little spasm thing, and so sometimes it helps amend that issue while your body's recovering. So
Yep. And if it's some weakness just with the pelvic floor in general, there's some exercises that you can do.
pelvic floor physical therapy is it's coming. It's happening now.
Yes.
Yeah.
And I've started having, I mean, there's some patients every
Yeah.
now and then that'll ask, do you have a physical therapist that will do this, that will come see me? I'm like, no, I'm sorry.
Yeah.
But there are ones that do it, after discharge, that you can always, make an appointment with or whatever. I don't know if your insurance will cover it. That'd be something that you'd have to check with. But
There's a lot
but
more.
it exists. But there's even exercises that you can look up online that you can do, in your own home.
And
Just
that's
a few times a day.
Quick little pelvic floor exercises. Google pelvic floor. Those are your words.
Bridges.
Yeah, those are your words.
Kegels. Yeah. So.
Those are very helpful.
Yes.
On the opposite token, if you had a C-section and you have a catheter in, we get this call a lot too. And sometimes we'll leave the catheter in while your body's recovering. Give it a little bit. We don't want to take it out immediately. Obviously, you can't walk. Things like that. They'll call us, say, I have to pee. Like, but you have a catheter in. What's happening in that situation? It's also a normal sensation. And we're like, just pee. And it's weird to just say that, because we can't do anything about it in that moment in time. Maybe adjust your position in bed. We'll check the catheter line, make sure it's okay. But what's happening right there is there's a little tube that's stuck in that urethra. So that smooth tissue, that smooth muscle tissue in there is like clenching around it, going, what is this? Why is this here? So that little muscle spasms, and it almost feels like you have a UTI, where you feel like you have to pee a lot. And that's what's happening. So you don't necessarily have to. And it sometimes is quite uncomfortable for a lot of people. So you don't necessarily have to. It's just there's a tube in there disrupting your poor body.
I always hate that. I hate telling patients that, because I know it's so disappointing. It's like, I'm sorry, there's nothing I can do about it.
Sometimes if they're
and I know that they're truly miserable with it.
And sometimes if they've been up a couple times, or if they need to get up, I'll take them and just do the warm water, like the peri bottle. And sometimes it's helpful, but other times it's like, I can't get in there and tell that little tiny muscle to behave itself, because but it's normal. It's weird, but it's normal. Yep.
Okay. Lots of phone. I keep saying phone calls.
That's okay. It's like when we did the Rogaine episode, we were like, the Rogaine vaccine. We're like, it's not a vaccine, but okay. We keep calling it that. So phone calls, this works.
Make my brain stop doing that. Okay. Moms will be very worried about their swelling, especially in their feet and ankles. Honestly, it gets worse before it gets better.
It does.
The majority of the time. We just got to give it time. Sometimes it may be a couple of weeks before it completely goes away. But I'm telling you, your feet may feel so tight, look like little balloons.
I tell people, I'm like, you might be walking on water balloons for a couple of days, and they feel bad. They feel like your whole foot is going to burst open.
Yeah.
Like I feel so bad for some of these women, but yeah, especially for a hospital delivery, we're going to give you lots of fluids, and then your body's going to go through a phase where it's like, I'm going to keep that. That's mine. I need it. I might need it. I'm going to save it for later. And so that's what happens. It retains everything that it possibly can. And then when you recover in the next few weeks or so, just you'll start peeing it off. So
Yeah.
the biggest clincher that I tell people in that one is if you go home and it's it's getting worse and worse and worse and
Right.
worse. And it's going to your face and your hands. We might call your OB in that situation.
Yes.
There might be something a little extra
wanna
happening there.
Check the
Yeah.
blood pressures.
Yep.
Also, I mean, usually we're just looking to see if left and right are equally swollen. Mm-hmm. If one side is much more swollen than the other, pain in the back of your calves when you take a step or flex your foot,
Or if it's
or if there's
red.
any redness or warmth.
Mm-hmm.
Those are possible signs of a blood clot. But if it's just good old-fashioned balloon feet, that's pretty normal.
Good
Just
old fashioned
give
balloon
it
feet.
time.
Yeah.
Just give it
You don't
time.
pee it off. Keep walking. Keep walking. Keep walking. I know it sounds silly, but keep walking. Your body will start recovering it.
Yep. Keep latching and keep walking.
Yep.
There you go.
Yep.
2 keys.
If you take away anything, yep.
Drink lots of water.
Well, this is a fun one. Fear of having your first bowel movement, whether it's post C-section, post vaginal delivery,
Across the board.
across the board. It's not gonna be fun, but
Scary, scary
Yes.
for everybody.
yes. So what I always tell people, don't try to force anything out. You're pushing, if you push down on your pelvic floor, you're straining any tears or any sutures that may have been repaired for any repairs happening down there. But usually I feel like your nurses or whoever are pretty proactive. Like I feel like I'm pretty proactive as far as, hey, I'm going to start giving you a stool softener. If it gets bad, we might give you some Miralax. I try to avoid the stimulant laxatives. Like I'm not a big fan of those, but we'll try to give you something to help make it a little bit easier when it's time. So
Yeah.
common myth is that after a C-section or I've even heard vaginal deliveries too, you have to have a bowel movement before you leave the hospital.
That was back in the day.
You don't need to do that now. Otherwise, we'd have
No.
people in there for 4 or 5 days.
We did back in the day. Oh my goodness.
Nope.
Like we're talking like right around 2000. Oh yeah, everybody had to, and if it wasn't happening, it was going to be forced to happen.
No.
We would be pumping patients full of everything
And-
because these docs would make patients stay. That is not the case
No.
anymore with anybody.
Yeah.
And I haven't seen any detrimental effects
No.
from that.
As far as C-sections, as long as you're passing gas and I hear your belly moving and grooving, I'm okay with it. Keep walking. Walking actually does help the process of motility, so you can have a bowel movement, but also you got your, like we said, stool softeners and Miralaxes, milk of magnesias, things like that.
Lots of water. Water.
Prune juice. Mm-hmm. Little coffee
Juice
and
with butter.
I was gonna say prune juice, some butter, coffee
I know
and butter,
that sounds so disgusting.
espresso
but
and butter.
Yeah. There you go.
I used to, when I worked at geriatrics, I used to call that a butt bullet.
That's funny. Yep. Brown cow.
Yep.
Yeah. So
Or Taco Bell. Go get you some Taco Bell. That might help you. But yes, don't force anything out. Please just kind of let it ease, maybe a little bit of pushing, but don't force anything.
yeah.
So.
It'll happen. It'll happen. Get you some coffee. Oh my goodness.
These poor mamas.
Okay, lots of patients call because they get the chills or they feel really flushed and hot. Sometimes one extreme to the next. It's all hormones. It is all hormones. And if you have one of those little, I know we talked about it before, and I think we even put on our list of products recommended, the fans with the little curly legs. You can
The
put it
grippy,
on your
yep.
bed. Yeah, on your bed rail. Oh, that's the best. Moms love those because you can turn it off and on whenever you need to. But, I mean, we'll always check your temp. If you tell us that you're having chills, we're going to check your
We'll check
temperature.
your temp. Usually, too,
But
a lot of the times right before you breastfeed, you might get a surge of chills. And I think it's just your body ramping up the antibodies. So, because you're about to breastfeed to give that to baby. But I hear that a lot too. Like, I feel like I'm getting the flu. Like, again, we'll check your temperature, but it's usually just hormones. Just the good old hormones.
And speaking of, once you get home, when your milk is coming in, sometimes you will get a low grade temp.
Temperature.
Yeah. So.
Again, that's the body protecting the milk and the baby. So,
Yep.
Also, to add to that, not hormonal, but I will say if you are post-delivery and you get uncontrolled shivering, and you may not even be cold with it, the uncontrolled shivering that may happen from like either anesthesia or recovery or whatever, that's
happens
normal.
a lot.
Yeah, that's also normal. You may be on the toilet for the first time standing up, even if you had no anesthesia of any sort, and you may just start uncontrollably shaking. That's normal.
Yes.
Recovery process. Not sure what that cascade is called necessarily, but that's a normal happening.
Yeah.
So.
I mean, it can be so extreme. Sometimes
Yes.
you can literally see and hear their teeth chattering
Yes.
together.
It can be pretty gnarly, but
Yep. That too shall pass.
yes.
Okay. Still having contractions. Yes, actually, indeed, you are.
You are. You are.
You are, and we want that.
We do.
It's only temporary.
We don't want the
Again.
pain for you, but
Right.
we want you. So, yeah.
I always tell moms, I'm like, there's a silver lining to that.
Yes.
Number one, it's only going to last a couple of weeks. Number two, your body is doing its job.
Doing its job.
It occurs with, especially if you're breastfeeding and you're putting the baby to breast, your body releases oxytocin, which is the same thing that we give to induce labor in labor and delivery. We use it post-delivery to help control your bleeding, but your body will release some of that when baby has a good latch. That nipple stimulation releases the oxytocin and makes you cramp so bad. So on one hand, I always tell mom, I'm like, yay, the baby's got a good latch.
Yes. At least your baby's latch good.
But it's helping get that uterus back down to normal size. The more you're cramping, the quicker that's going to happen.
It's true. It's painful and terrible, but it's true.
And it's controlling the bleeding, which we also want. So, a lot of times we'll give, usually NSAIDs work the best for that, over the narcotics even. So, if you can take NSAIDs, that's a good time to take it. Also, warm packs
I was going to say hot packs or warm packs.
help to relax
Yes.
that uterus a little bit. And moms feel it more with each baby that you have. So a lot of moms will say, I didn't feel this at all like this when I had my last baby. Yeah, there's a reason for that.
Bit different muscle.
Yep. And your uterus is just, it has to work a little bit harder because it's more stretched out.
It is.
So just be reassured that it's only temporary. It's only temporary. And it's doing its job.
I will also say too, when your bladder's full, it'll migrate that uterus around. So your little uterus, when it's trying to do its job, when your bladder's full and you're trying to breastfeed, empty your bladder first. That will help a lot. Empty your bladder before you breastfeed, because that will, if you've got full bladder trying to breastfeed, your uterus it's going to make the sensation to pee worse. So you're going to feel like it's just not going to be comfortable. So empty your bladder before you breastfeed, and that will kind of help that control it as well. But yes, like she was saying, it's a temporary thing. Warm packs, heating pads. Please don't set your baby on the heating pad while you're breastfeeding. But I've had a lot of moms be like, is there something else in there? Do I have, am I giving another placenta or whatever? I've had someone ask that before. I'm like, no. It's okay. It's normal. Very uncomfortable, but normal. So, and again, everybody's pain threshold is completely different. So I've had some moms be like, this is fine. I'll tolerate it. It's fine. And then some moms are coming out of the bed because the contractions are so bad. But
I had a mom recently who had her 8th baby, and she was like, no, I'm good. I feel it a little bit.
I already know who you're talking about.
It's like, wow.
Yep.
That's impressive.
She's like that with her other ones too.
Like you were totally made to have babies.
She was. She 100% was. I know exactly who that is.
Oh, gosh.
Last one?
Yeah.
Can you shower after a C-section?
Yes, please.
Yes, please shower. God, yes. Shower. We want you to shower. You can shower the next day. You can shower as soon as you can walk. Let us know. There will be some incision care. And lately, again, depending on your facility, we actually use the special soap called CHG, the chlorhexidine-based soap. And what it does is it kind of creates a barrier on your skin there. So critters,
It's
any
antiseptic.
any sort of so you don't get an infection in that incision. A lot of our physicians these days are using either the negative pressure dressings that basically they have the dressing with like a little box situation, little or big, just depending on the brand, the manufacturer. Or they're using a silver impregnated dressing. And those will usually stay on for a couple weeks at least, again, depending on the physician. You can still shower with that on. You can still use the soap with that on. They will tell you or ask your healthcare provider if they didn't explain to you, they will tell you when that's supposed to come off. When that does come off, we still want you to shower. We still want you to shower when that comes off. So you'll still use the soap. Of course, you're not going to be scrubbing it. You're not going to be scrubbing the incision site. You're going to let that soap gently run over it. Maybe do a gentle pat, and then rinse it off with some gentle water. Be gentle. It's a hole in your body. So yes, we still want you to shower and do all the things. Honestly, you're going to feel like a whole new woman when you shower. Please don't wait until that dressing comes off. Even if it's like a short 3-day dressing, please don't wait. Just shower. You'll feel so much better. That gives yourself the time away. You get that little moment to yourself.
Yeah.
It's nice.
For
it's
real.
lovely. But yes. And if you don't get any instructions on how, you can always call back or call your doctor's office.
And some of these incisions I've seen, on occasion, the edge of it will start to come off and it gets wet in the shower. Call us. If you're still in the hospital, we just replace it. We take it off. We dry the incision. We put a new one on. If you're at home and that happens, don't leave a wet dressing on the incision. It will just breed bacteria and you would probably end up back in the hospital for an infection.
And if you have to take it off, like she's saying, if you're having to take it off at home or the doctor tells you, go ahead and take it off. It's just like a Band-Aid. Trust me, everything underneath there is either sutured or glued, or it's not just going to open up to a whole wound. It's fixed in there. That usually what those dressings do is they draw, because it's a natural process of our body while we're healing to exude some drainage. Okay. Usually we want it clear or like maybe a pinkish tint.
Right.
But you don't want it green, you don't want it yellow, you don't want it to smell bad. Those are the signs of infection. But usually what those dressings do is in your first few days, it draws the drainage, the excess drainage away from the incision, so it heals a little bit better and a little bit faster and a little bit cleaner, y'all. So yeah, we could try to leave that on, but like she said, if you get home and it's just flapping all about in the shower, just go ahead and take it off.
Don't leave it on there. And then just make sure you dry real good. I tell moms, use your hair dryer on a cool setting, low
That's a good
setting,
one, yeah.
just to get it really good and dry
dry.
before, you put your underwear back on. So,
Or if you've got, I will say this, if you do have a little hangover, a little panis, a little apron, you can, I tell some of my moms, take one of your peri pads,
Yes,
like your
exactly.
softer peri pads, and you can set it. You're not pressing it on there. You're not taping it down.
Yeah.
You can set it on your incision while it's kind of drying, or if your panty line is rubbing on that area.
right.
Then
Yeah.
you can use one of those. That way it keeps the, because when your skin's kind of folded over, moisture, humidity, we live in Texas, all that accumulates. I guess no matter where you live, and your body's 98 point something degrees. That humidity will accumulate bacteria, infect the incision. So you can at least have something to keep it a little bit drier. Mm-hmm. And the hair dryer is a good idea.
Yeah. Yeah.
It really is.
Just a cool low setting.
Yep.
All right.
Well, again, if you've got a postpartum recovery concern that we can answer or that you want to contribute, please let us know. Please let us know. We'll be happy to help you. But other than that,
Reach out to us if you have any questions. Please and
subscribe. Yes.
Please subscribe.
Keep
Please
latching.
Share.
Keep latching. Keep walking. Happy healing.
Keep drinking water.
Glad you added water.
Yes. Yes.
All right. Happy healing, y'all. Have a wonderful night.
Bye. Thank you for listening today. The Rattled Nurses podcast is not intended to provide medical advice. It is not endorsed by our employer, and we are not speaking on behalf of our employer. Our commentary and stories are our own.
Also, on a serious note, we want you to know that if you are feeling blue or depressed, it is okay. You're not alone, and there is always someone to reach out to. You can call the National Maternal Mental Health Hotline at 1-833-TLC-MAMA or text the crisis line, text HOME, HOME, to 741-741. Remember, you're doing a great job. Now go warm up your coffee.